Welcome into 12 News at 6. The deaths of Kansas kids continues to decline to the lowest level since the 1990s, but it is not without challenges. That according to a new report from the State Child Death Review Board of Kansas.
That group has been investigating the causes of death for kids from birth through the age of 17. New at 6, Sean Logging looks at some of the concerns in the report and the actions that they're recommending.
To start with the positive, the 2023 report from the Kansas State Child Death Review Board details the state hit the lowest number of child deaths since the board's creation in 1994. This year's report is looking at data from 2021, the most recent available. It shows for 2021, 349 child deaths, which cover the ages of birth through 17 years old. About half of those deaths are natural causes, which the Death Review Board says have been declining significantly in the last 5 years. While those have gone down, the board is seeing an increase in deaths caused by homicides, weapons, and drugs. Homicides of kids reached 32 in 2021, about double the number seen in 2020, and higher than any of the 5 years reviewed in the report. How they happened, the report cites it being at the hands of a family member or friend related to drug transactions or child abuse. Most of those deaths from firearms. Firearm-related deaths are also up in this report, 44 in 2021, more than the number of children who died from car crashes, which was 36 in 2021. Fentanyl was also blamed for a sharp increase in drug-related deaths for kids, going from 0 to 20 overdose deaths combined for 2020 and 2021. The report also includes about 24 recommendations, including improving reporting and investigations of child abuse and neglect, increasing access to crisis and mental health services for kids, and improving the process of investigating a child's death. None of the recommendations address firearms. The report also says the number of sleep-related infant deaths on overall increase during the 5 years covered in this report, with 51 in 2021. The report also notes racial disparities, with black children having a higher rate of death than the state average in all categories except for suicide.